Flap 2. The stations I used to struggle with. So I remember when I used to practice with my friends, we used to sit around, give each other all these random topics, all these random stations that we used to come up with. We used to create the scenario. There was one that used to always slip under my nose. It was thyroid. Any station that is about thyroid, I used to struggle with it. Now I can see that it's very simple. Really, genuinely. When you get a patient with thyroid issues, you're not going to get it. No, you're just going to see the full picture. What you need to know is when you need to order thyroid. When do you have to order TSH, T4, T3? So basically, hypo, diarrhea, constipation, both cause tiredness, both cause mood change, weight loss, weight gain. So when you hear all of these, you need to get used to the idea of just saying thyroid function test, TFTs. Normalize this so in the exam it wouldn't slip under your nose. The other thing I used to struggle with is the type of referrals. When I used to prep, I used to study the NICE, the NICE's guidelines. I remember it said if it was a secondary cause or a secondary hypo or hyper, we make an urgent referral. Other than that, it's a routine referral. What you need to understand is that you're going to go through the history pretty much the same. Once you get to the examination bit, you're going to vocalize that you're going to do them. If they were kind enough to give you a piece of paper that says the patient, that gives you the result of the test results, you can easily say, okay, this is hypo, okay, this is hyper. Whether you start them on anti-thyroid medication or on levothyroxine, you need to remember when you start any patient on medication, you need to know the side effects. This is crucial because you want to safety net the patient from the side effect that they're going to have. You also would like to know how to start and how to escalate. So for example, in levothyroxine, we usually start low and go slow. These small bits, if you don't remember in the exam, that's okay. You can check with your seniors, you can check with the pharmacist on the department, because even if you're in a GP clinic, you have a pharmacist there. You can check with them, that's easy. Bottom line, once you hear constipation, diarrhea, weight loss, weight gain, mood swing, normalize saying, I want to order a thyroid function test, because it could be a thyroid station and you have no idea. If you get the diagnosis wrong, it's not a big deal. Remember this. It's not the end of the world if you get the diagnosis wrong, but you manage on an open odds for anything that it could be. Remember